Здравствуйте, уважаемые участники.
Good afternoon, dear
Мы очень рады,
participants.
что вы сегодня
We
с
are
нами.
very happy that you have joined
Традиционно
us today.
начну с того,
Traditionally,
что
I would like to
наша
start with the
сегодняшняя
following.
встреча будет
Our
проходить на
today's
двух языках,
workshop
на
will be
русском и
held
на
in
английском
two
языке.
languages,
Для
Russian
того,
and
чтобы
English.
выбрать удобный для вас
To choose the
язык,
language of your
кликните на
preference,
иконку глобуса в нижней
please
панели
click on the
Zoom,
globe button at the
или
bottom of your
этот
screen
иконку
in
также
Zoom.
может быть скрыто
Or
под
this icon can
в
also be
разделе
hidden
«Дополнить».
in the
И
section
после
Additional
этого вы
with three
сможете выбрать
dots.
удобный для вас
And
режим.
after this, you'll be able to choose the language that is
Я
most
очень рада,
convenient for you to
что у
listen
нас
in.
есть
I'm
возможность
very happy that today
посвятить
we are
обучение
presented with an opportunity
целых
to
два
talk
воркшопа.
about a training
И сегодня
topic,
мы с
and
вами
we
вновь
have two
встречаемся
workshops for
с
this.
Эсминой
And
Кайпхановой.
today, once again,
Эсмина
we are
эксперт
meeting
в
Esmina
разработке и
Kaibkhanova.
реализации
She's an
образовательных
expert in
программ
the
для
development
медицинских
and
специалистов
implementation of
в сфере
educational
паллиативной
programs for
помощи.
medical professionals in the field of
Эсмина
palliative care.
руководит центром
Esmina leads
обучения,
the
который,
Center for Training
можно сказать, обслуживает большое
that
медицинское хосписное учреждение,
supports
Центр
a
паллиативной
big
помощи в Москве.
palliative care
И за
center
годы
in
работы учебного
Moscow.
центра
And
создано
over the
более
years
15
of this
уникальных
center's
программ
work,
повышения
more than
квалификации
15
в паллиативной
unique
помощи.
advanced training
И эти
programs in
программы
palliative care were
изучили
developed.
более
And
3
this
тысяч медицинских
program
специалистов из разных
was
регионов России.
given to more than
Сегодняшняя
3,000
встреча мы
professionals
называем
from different regions of Russia.
потому
Today, we
что
call this meeting a
всем
workshop
нашим слушателям
because
предстоит
all
принять
our
непосредственное
participants and
участие.
listeners will have to
Эсмина,
actually
конечно же,
take an
подготовила
active
несколько
participation in the
упражнений,
meeting.
которые
Esmina
помогут
has
нам с вами
prepared
лучше
some
усвоить
exercises that will help us
содержание
to
сегодняшней лекции и понять, как мы можем в своей практике применить
understand the meaning of
те знания,
today's
которые
lecture
мы
in a
из
better
нее с
way and
вами
how to apply the
выберем.
knowledge that we will get
Для тех, кто
today
уже
from
прежде
Esmina in
присутствовал на
practice.
первом
For those who've
воркшопе,
already participated in our first
вы знаете,
workshop,
что
I would
эти
like to
лекции
remind
очень
you,
всегда,
you
с
probably
удивлением для
know
Эсмины, всегда очень
that
информативные и очень
Ismina's
прикладные.
lectures are
Позвольте мне
always
сказать
very
также пару слов
informative
о
and
себе.
can be applied in practice. Just a couple of words about
Меня зовут
PASTE.
Ира Черножукова.
My name is Ira Chernozhukova,
И я представляю
and I
Foundation for
represent
Palliative
the
Care Education,
Foundation for
сокращенно
Palliative Care
ФОПС.
Education,
Это
PASTE in
благотворительный фонд,
short.
который был основан в
This is a charitable
2017 году.
foundation that was established
И
in
мы поддерживаем
2017.
специалистов
We
по
support
паллиативной помощи
palliative
в
care
странах
professionals
Кавказа, Центральной
in
Азии, Восточной
Caucasus,
Европы и
Central
странах
Asia,
Балтии
Eastern Europe,
в
and the
получении
Baltic
профессиональных
countries.
знаний
We
и
support them in
владения
acquiring
национальным
knowledge
опытом.
and exchanging
Сейчас
professional
вы в чате
experience.
увидите ссылку
Now,
на
in the
сайт
chat, you'll see the
нашего
link
фонда,
to the website of our foundation.
где, например, в разделе Publications
We
вы
have a
можете
section
ознакомиться с нашими
publications, and
последними
there you can read
новостными
our
дайджестами
latest
или интересными
news
публикациями
digests or some
о
other
специалистах
recent
в сфере
publications from
паллиативной помощи, о
experts in the
лидерах
field of
паллиативного
palliative
движения.
care,
Все
from the
материалы мы
leaders of
дублируем
palliative
на
care
двух языках,
movement.
на русском и на
We publish
английском
all the
языках.
materials into languages,
Чтобы
Russian and
оставаться с нами на
English.
связи,
To keep in touch
также
with
мы
us,
очень рекомендуем подписаться на
we
новостной
really
рассылку,
recommend you
также на
to
сайте.
subscribe to our
И вы
newsletters.
всегда
You can
вовремя
do it
будете
also
получать
via
анонсы
our
наших
website. And
будущих
that's how you can
мероприятий.
get updated on time about
Также я
our
хотела бы
events
воспользоваться
in the
возможностью
future.
и
I would also like
попросить
to
вас,
use this
уважаемые
opportunity and
слушатели,
ask you, dear
делиться
participants
анонсами
today,
наших мероприятий
to
и наших
share
инициатив
the
со своими
announcements
коллегами,
about
потому что,
our
конечно
events,
же,
our
личные
initiatives with your
рекомендации работают
colleagues,
в 100 раз
because
лучше,
personal
чем просто
recommendations, the
увиденная
word
где-то
of mouth,
публикация.
works much
Я
better than
призываю
just
вас
a random
делать
publication that one
репосты
can see.
наших
That would be very
материалов
nice if you
в
could
своих
repost
соцсетях
and
или
share
же
our
высылать
posts
ссылки об
in
этих материалах
your
вашим
channels
коллегам.
on your social
Например,
media,
прямо
or maybe you
сейчас
could also just
PACE
share links with your colleagues
принимает
directly.
заявки от
For example,
специалистов
now
в сфере
PACE is
паллиативной помощи
accepting
на грант.
applications
Грант
from
профессиональной
palliative care
мобильности. Под
professionals
этим мы
for
понимаем,
the
что вы
professional
можете подать
mobility grant
заявку
in
на
palliative
поездку
care.
на
So you can
международную
apply for a
конференцию,
grant to
на какую-то
support your
стажировку или иное обучающее мероприятие, где вы сможете
participation in
встретиться
some
с
international
коллегами
conference, some workshop,
из других стран и
etc. The
обменяться
places where you can meet your colleagues
опытом,
from other
знаниями и
countries
иметь
and
самые
exchange
полезные практики.
experience, knowledge, and get the best
А,
practices from
Также
your
у
peers.
нас есть телеграм-чат
On top of
для
this, we also
специалистов
have
из
a
тех
Telegram
регионов,
chat
которые
for
я перечислила.
professionals
И
from
в этом
regions
чате мы
that
также
I mentioned
регулярно
before.
ведем
And in this chat, we regularly publish the announcements of our events, as well as we publish other different interesting posts and materials. If you'd like to join our Telegram chat, also in our chat here in Zoom, now you will see the link to a Google form. Please fill it in, and in a couple of days or in some time, we'll connect with you and invite you to join this Telegram chat. We only have palliative care professionals in this chat from different countries. Once again, for those who have just joined, I would like to reiterate that today we held our workshop in two languages, English and Russian, and you can choose the language to your liking at the bottom of your screen in Zoom. Today, we are supported by interpreters, simultaneous interpreters. Our names are Anna Akmaeva and Yulia Kuvashova. And at any point of time today, if you have a question, please use our Zoom chat. We will definitely get back to your question in our final part of the meeting. We will not lose it. Now, let me pass the floor to our lecturer, speaker today, to Esmina. Esmina, the floor is yours. Right, colleagues, good afternoon. Now I'll share my slides and we will be starting. I hope you can see my screen now.
И я сейчас тут как раз делаю свои базовые настройки.
I'll just set it up properly.
Последние. Да. Ир,
Right.
спасибо за представление.
So, Irina, thank you very much for this introduction. As Irina has said, dear colleagues, just a second, I'll also adjust my screen properly. So, this is the second workshop in a series of two workshops on training tools. Today, we'll talk about how to understand whom, what, and how exactly to train when we plan some training. Just a couple of words about myself. Ira has already introduced me, but I'll just like to give you a little bit of more details. Just very briefly about my experience that I proceed from when I share my knowledge. I don't claim to be the top expert, but still I work in the Center of Palliative Care under the Moscow Healthcare Department. We have a lot of employees, we have a lot of hospitals in our network, and once this center made the network from different hospices and hospitals, we understood that we had to get our own center of training and development of our personnel. So we draft training programs and we also build algorithms that serve as a foundation for our training programs. It would be interesting for me to know, please put a plus in our chat those who already have the experience in training personnel. If you have any experience in training personnel, your colleagues, please put a plus in the chat. My dog is barking and this is a good opportunity for you to respond in our chat to my question. If you have any experience in training your colleagues, personnel, please put a plus sign in our chat. Right, actually, Irina says I already see some pluses from our colleagues from Armenia, from Kazakhstan, I guess, if not mistaken. Right, thanks a lot. Then, dear colleagues, I guess it will be interesting for you to compare our experience with yours. Just briefly about what we discussed last time. Last time we were discussing diagnostics and therapy of working tasks. What can we solve with training? And we discussed not how to train, but we mostly discuss how to understand whether we need to give training. Now we are talking about advanced training, right? Different programs of advanced training qualifications. And the first question that we need to pose to ourselves, and that was the topic of our workshop last time, the main question is, what working task are we trying to address? Is this a problem? Is this something new to implement, right? Because advanced training is aimed at solving some specific task, some specific issue. And before addressing this task, we really need to understand our goal. And on top of this, apart from training, what else is needed to solve this problem or this task? And whether the training should be the priority for us or it should be one of the last elements in our chain, well, all other obstacles are already removed. And I suggested 3 steps. First, to formulate the problem. Quite often we can combine and confuse different problems, causes, etc. Second, we need to identify the root causes of the problem. And third, we need to plan the solutions that can help us to solve the problem and to remove its causes. And I also mentioned last time that, well, lack of knowledge is not a problem as it is. It can be the cause of a problem, but the problem is something that negatively affects the quality of medical care for patients or professional activities of a medical institution. And so one of the examples that we got from colleagues last time, somebody also sent me their homework that I had given last time. So one of the examples is the problem. The pharmacies do not buy narcotic drugs because there is a small demand for this, because doctors do not prescribe narcotic drugs. So this is the problem. Then the causes. Why does this happen? Because of the lack of knowledge, difficult document flow when it comes to the prescriptions of narcotic drugs. Next one, patients are afraid of those. And last one here, there is no interaction between the doctor and the pharmacist. So, as you see, even if we train doctors, this will not be enough to solve this problem, because if we don't remove other root causes of the problem, then the training is not a silver bullet for us. This will not help completely. And what are we going to talk about today? We already discussed the problem formulation and root causes, etc. Today we'll talk about how to plan a training program that will be applicable in practice and will not take too much of our time. Obviously, everybody has little time, little attention to some other tasks within their professional activities, and we really need to be very specific with our training and only include some useful information in the training program. And we will talk about some basic rules. Those are not all the rules, but still, I would like to prioritize those. It would be very nice if I had heard and learned about these rules when I was getting trained in palliative care. So, first rule, we need to identify what are we going to train people in. Second, we really need to plan our training results. And third one here, we need to plan the format of the training. When we understand what we are going to train in, we need to understand how we are going to do this. And so I was thinking about organizing this workshop today. We have 90 minutes for this today, and the topic is quite wide. But today we will do the methodological sorting with you. We will not dive very deep into this topic because it's like a whole ocean and underwater, under surface world. But we will still talk about some things that are already closer to the surface of this ocean. So, step 1. We have a topic, right, in what we want to train people. And last time I already gave you this comparison, how we diagnose the working problem. I compared it with our treatment process. First, we need to collect the complaints and medical records. And for training, during the first step, we need to do the preliminary research on this topic. We need to understand what our goals and expected results and what will be the content of our training. So, whom are we going to research and why? The first group here is the customer and the stakeholders. Stakeholders are those people who are interested in the result. In our case, on top of those who will be trained, this could be some ministries representatives, some leaders of medical institutions, as well as patients and their relatives. Sometimes it's more difficult to talk to patients and their families because of some ethical matters, but we can talk to some governmental representatives and representatives of the medical institutions. Why do we discuss this with them? We need to understand what working tasks we are trying to address and what needs to be done to do this. Then, target audience. Those are doctors, nurses, etc. We also need to cooperate with this target audience to understand how we should train them, how people accept this information, receive it. So those are the main goals of our preliminary interaction with our target audience. And we also need to research the context or environment. Basically, we need to understand the demand coming from our target audience and how we can also later transfer this knowledge to practice. Of course, we need to read literature and read documents on this, but here on this slide, I just mention something that is not always done, but what really helps to create some practice-oriented programs. And these can be not always evident and very clear things. Just an example from practice. Why is this preliminary research so important? Why this is not just theory? So I'll give you an example. We had a customer. It's a medical senior chief of a medical institution. The problem was to decrease the number of mistakes made by palliative care doctors when they prescribe psychopharmacotherapy. So I already given you our numbers. We have 633 beds in our network, hospitals around the whole city, a lot of patients, and well, I guess you also have the situation we have doctors in our palliative care departments, not only those who actually worked in palliative care, but also just general practitioners. So first, we talked to psychiatrists, experts. We have a special service, and this service helps to consult in the field of psychopharmacotherapy prescription. And these psychiatrists, experts, told us that the biggest challenge is that doctors cannot really distinguish between anxiety and depression, because if it's depression, then indeed the right therapy should be prescribed. It's depression, but anxiety is a different condition, and here one just needs to support the patient emotionally to calm the patient down. And sometimes, even if it's only anxiety, the depression is diagnosed and prescribed, and this is our pain point. And so when we talked to doctors, we learned that the most challenging thing, and it's not a surprise, and the psychiatrist said that it's very difficult to actually deal with the psychomotor agitation and delirium, especially during the weekends and at night. Because if we take a look at the context, we understand that during daily hours, one can call a psychiatrist. Psychiatrists do not work in all the hospitals, but at night it's difficult. And what shall we do, especially young doctors, those who haven't seen these conditions before? And of course, they're afraid of this when the patients become really uncontrollable and they believe that there are killers around him.
And so it became clear that we should pay attention to this very topic. So we dive into the problem before getting to education or training. We have performed this study and influenced the goal of the program and the scope of the program. There is another example. Our colleagues from a regional hospice addressed to us with the following demand. So the doctors needed a training on bleeding. So we have some cases of bleeding and physicians do not know what to do. So we would be glad to gain experience in stopping the bleeding. What should be done? An ambulance should be called when, and so on. And so we analyzed 17 clinical dossiers, and we found out that some of the majority of the cases are iatrogenic. I won't go into detail about the demand exactly, but we found out that actually what seemed to be the main issue to be trained was not like this after the study that we have made. There was another study that we have conducted about the time that physicians are ready to pay to training. So 15-30 minutes per day. 41% of physicians are ready to do this. 30 minutes a day, it's maximum, or on a weekend, in the evening. These were the examples. And we understood that if we conduct a training or develop an online course, and this is something that we have been doing because we have a big audience, we have quite a few experts, and this is a good format, a micro training. One lesson represents one topic. For example, if a person has 15 minutes, he or she would be able to study a short topic. I have taken some examples from our recent workshop. Some of the colleagues said that when he or she tried to understand why there were difficulties in prescribing narcotic substances, it turned out that physicians in this palliative center thought that narcotic substances could be prescribed only 3 times a day. And other physicians thought that morphine has a daily analgesic ceiling dose, citing works on medicine. So these can be taken into account while developing training. We say how to do it in the right way, and we can provide the sources, reliable sources that cite how it should be done. And physicians can look into the information they need in these various sources. If a belief is supported by a reliable source, it is always better, and it can be very useful. There was another example as well. Colleagues said that there were some cases when physicians were afraid of prescribing opioids, or patients didn't want to take them because the Quran prohibits to do it. And the colleague that said that, who was the chief medical officer actually, he said that he tried to work with the theologists and to convince physicians that the Quran does not prohibit it. And in my own experience, there was a case when a
Russian physicians did not prescribe the narcotic substances in the right way. There is a classical rule, and they didn't follow the rule, not at all. And it turned out that actually it was the chief medical officer who did like this. And so the colleagues follow him. And we understood that the first thing to do was to work with the chief medical officer. I showed to you why this study was important, and now we will move to the tools. So you can see several tools here, including interview, mass surveys, the analysis of mistakes and incidents, overview of the working environment, tests and articles and books. And in yellow, you can see the tools that healthcare centers do not use. The white ones, this is something that we use regularly, and the yellow ones is actually something new, something that targets the real causes of problems. I will talk about in-depth interview and mass surveys. And as for the rest, we will touch upon this quite superficially because it's quite a complicated problem. So in-depth interview, this is a tool that is used in marketing, in advertisement. There are many works on this. You can speak for many hours about the techniques to conduct in-depth interviews. What is the objective? It is a discussion, it is a conversation, a personal one when we ask individual questions. And the goal of this is either to formulate a hypothesis or to check this hypothesis. For example, we understand that physicians do not prescribe several substances, and we suppose that it is because they do not know how to do it. And this is something that we want to check. And it can turn out that they're just afraid of doing this due to religious reasons, for example. And as a result of a dialogue, we should understand what should be trained, actually. Then we can find out some precise, concrete issues, and I will show it on an example. Then we can also assess motivation, for example. Several people can say that, well, they're so tired of their work and they do not want to get some training. Why? And then another goal is to understand the possibilities and the constraints. Because as a result of a dialogue, we can understand sometimes that there are the constraints that do not allow them to conduct a training, especially if we are talking about online training, for example. Some people do not have the access to the internet or PCs and so on. So every tool is useful depending on the possibilities and constraints. And if we're talking about the in-depth interview, there is a client and there is a target audience. It is better to conduct in-depth interviews personally, and the number of respondents should stand at 3. For a homogeneous group, here we're talking about physicians. For example, senior nurses form one group, chief medical officers form another group, and there should be multiple choice questions, and it is better to establish contacts between you and the group, because this creates confidence. And if we talk about
mass surveys. They have another objective. We just need to validate our hypothesis through a mass survey. For example, we have a hypothesis. Physicians think that analgesics can be prescribed more than 3 times a day. This is a problem because we should understand if the whole healthcare center thinks like this, or they're just some senior nurses who stick to this belief. And so we need to ask a question: how many times analgesics should be prescribed? Once, 2 times, 3 times, and so on. And the surveys like this should be conducted anonymously, because in this case, people would respond in the way that they think, and the number of respondents depend on the objective that we have, either 200 or 100. Everything depends on the objective. I will provide you with some examples. When we launched the healthcare training center, we tried to understand how to come up with the lesson plans. We had conducted 21 interviews with the employees. There were several groups with the physicians who have recently come to work there, those who have been there for some time already. There were anonymous surveys, and it turned out that new physicians lack something, like some knowledge. For example, with prescribing narcotic and psychotropic substances. When it comes to experienced physicians, it was the question of palliative sedation, or, for example, treating patients who are mentally disturbed. These were the problems that were more important for them. Then there was a question about the information sources that they try to address when they lack knowledge. You can see here that the most the answer that has been given in most cases was that actually there was a discussion between colleagues why there was another question about when it is better to conduct training, then how much time a physician was ready to accord to training. So we try to gain, to glean as much information as possible. And if we work on a concrete lesson plan or program, 18, 20 hours, or just a small workshop, it doesn't matter. We should conduct a study before developing a program. So we ask questions to understand what are the main issues. And this is how I worked with PACE, actually. And this year, we have come up with a new edition on dysphagia. The first edition was in 2020, and we have interviewed chief medical officers. We try to observe them in the working environment, and we got the results. And I would like to show you another example as well. And I cannot see the link. Ira, if I want to show you my screen, how should I do it? Yes. Just a moment. I will show you the results of the interview. Can you see the table? Yes. So, my colleague Ekaterina methodologist. She's here as well. So she interviewed the physicians. She asked questions, and then she came up with this table. So you can see several types of patients depending on the nutrition they needed, for example. And in the current course, we talk about different nutrition supports, and we ask colleagues what problems they face while prescribing nutrition supports. And you can see that, well, there is some food for thought. Some says that some people say that there is a scale to be taken into account when it comes to bed sores, patients with bed sores. There is another problem. There is patients do not like the nutrition support that they get, or there is another problem that family asks to prescribe the nutrition support when it is not actually needed. All nutrition supports change all the time. And as you can see, there are many questions with the answers given for every question. And one of the main conclusions that we made was as follows. We need a unified algorithm to prescribe the nutrition support like this. There are many things to be taken into account. And if you scan this QR code, you will get the information on this, on the mass surveys and questionnaires. You can see the examples of in-depth interviews and questionnaires for mass surveys. They will help you to build lesson plans and training programs. And as for the studies, I can say that even if you have the best expert in the world, it won't rule out the need to conduct a study. It is something that we do not think is quite useful in many cases, but actually it's very important. And even the word, the opinion of the chief medical officer cannot always be the right one. Only a study can give what is really needed to students and to the client. And now we move on to interactive exercises. I think I will do it like where I will leave the screen here. Could you tell me, or you can put it down in the chat? I think we have 10 minutes for this exercise. So what questions would you pose to doctors if you worked on a training plan, training course? If the topic was diagnosing and treating the chronic pain syndrome, then what chief medical officers would you address, and who would it be recommended to speak to study the issue? So I would ask you to answer these questions, and then I will share my expertise as well. So you have a minute to think about it. If you want, you can answer only one question, or you can give just an answer to all the three questions. Colleagues, you can raise your arm if you want to speak out, or you can put it in the chat. Please don't hesitate. I think it's a unique opportunity to speak to Esmina and to practice it.
Я вот, когда у нас приходят эксперты, ну, в качестве лекторов, и надо делать интерактивный формат, первое, чему мы учим, как только возникает пауза, становится сразу неловко, и хочется сразу начать давать ответы, но надо потерпеть. Вот поэтому я тоже подожду.
So, of course, I'll wait
Да,
for your thoughts.
вижу первый вариант вопроса
Right,
врачам.
so
Если у вас какие-то
I see the
сомнения,
first
когда вы
option
назначаете противоболевые препараты.
here. The
Кстати,
question
очень
to
хороший
doctors:
вопрос.
are
Слово
there any
«сомнения»
doubts when you
сразу
prescribe
позволяет не из серии, что, может быть, вы чего-то не
painkillers
знаете
and
или вы
analgesics?
боитесь. Сомнения. Отлично, спасибо.
It's a very good one
Коллеги, есть ли еще
because the
какие-то
doubt is a
предложения?
keyword here indeed. Thanks a lot. So, dear colleagues, do you have any other suggestions here? I will support you in this. Indeed, the phrasing, do you have any doubts, is a very good phrasing. It doesn't scare people, right? Sometimes we can indeed admit that we have some doubts, but it does not demonstrate the lack of knowledge or something. Right, thanks a lot for this phrasing indeed. It's a very good one.
Ну, подождем, может быть, будет еще варианты
Let's wait a little bit
Ага.
longer.
Есть ли у вас сложности в
Okay, next
получении
one. Do you
обезболивающих
face any
препаратов? Спросите у
challenges in
родственников. Ответ на вопрос 3.
getting
Кого полезно спросить?
analgetics? And
Абсолютно
we should also
замечательно.
pose this question to
Но у нас
relatives.
тут сейчас скорее
Exactly, a
тема
very good
диагностики и
question.
терапии
Here,
ФБС. Ну да,
now
по
we
выпуска
talk more
рецептов это,
about
по-моему, тоже
the
всегда как бы
diagnostics
приоритет.
and therapy of a chronic pain
Оцениваете ли
syndrome,
вы
but indeed this
выраженность
question is
болевого
also
синдрома
relevant.
пациентов без
Next
сознания или с
suggestion:
испытанным
do
сознанием?
you also assess
Да,
the
отлично. Как вы
severity of
взаимодействуете со средним и
the
младшим
pain
медицинским
syndrome in
персоналом?
patients that are
Как я понимаю,
unconscious
Тамара, да,
or
назначила
that
такую терапию.
produce some
Да,
delirium
очень важный
symptoms?
вопрос. Тоже у
How
нас
do you
был момент
cooperate
в
and
другом курсе,
communicate
что
with
не
nurses?
подумали
Right,
вот
a
про
very good
взаимодействие сразу
question.
спросить, потом оказалось, что как раз на этапе работы среднего персонала,
Indeed,
когда
when
уже
we
мы
work,
готовы делали, были трудности.
nurses
Первый
is
вопрос
a
тоже
very
хороший.
important and
Оцениваете ли
key
вы выраженность
element,
болевого синдрома?
and
Хороший
we
в смысле
indeed, of
тоже
course,
даст вам
need to
полезную
take
информацию.
those into account. The first part of the question is also very
Есть
good.
такая
How do you
рекомендация
assess
для ведущих
the
интервью максимально
severity of
открытые
pain
вопросы задавать.
syndrome,
То есть,
right?
ну, какие будут
There is a
пациентов вы
method that
оцениваете?
recommends us to ask
Вот.
as
Но,
open
в
questions as
принципе, если мы
possible,
понимаем, да, у нас есть
but
гипотеза,
if
что
there
не
is a
оценивают вот у этой
hypothesis
группы пациентов, можно сразу спросить и дальше спросить, а как оцениваете, а если не оцениваете, то
that we should
почему?
do something in accordance with a specific method, we can also just
Спасибо.
pose some questions
Я бы
to this
подождала
method. For
еще.
example, do
Вот,
we
кстати,
assess this in
пока
this group?
с
If
тем из
not, why not?
руководителей
And so on and so forth.
поговорите
I
и о
would like
чем
to ask my
спросите.
own
Вот очень
questions
интересно
to
было бы
whom
на
of the leaders,
тоже этот
managers,
вопрос услышать ответ.
would you talk, and what questions would you pose to these leaders and managers?
На всякий случай, простите,
Just in
добавлю,
case, I would like to
мой
add as well.
коллега подсказывает, что микрофоны вы можете включать сами даже.
You
То
can
есть наше
actually
участие это не
unmute
обязательно,
yourselves
просто
here
включайте микрофон и
in
говорите
Zoom.
во
My colleague
полголоса,
just
если так вам будет удобно.
gave me this hint. So if you want to speak, just unmute yourself and please go ahead and talk about this.
Ну, смотрите, да, если
Right,
желания
okay.
писать вопросы сейчас или возможности нет, вот есть.
So,
Какие жалобы
we've
от
got
пациентов
another
и родственников поступают по
suggestion
поводу
here on the
обезболивания?
question.
Да,
What are
спасибо
complaints
большое.
coming from
Не
patients
знаю, как
and
правильно
relatives
произнести имя, поэтому
on
не
the topic
произношу.
of pain relief?
Алоа, да, Алоа, спасибо.
Aloha, thanks a
Да,
lot.
нам руководители нужны как раз,
Exactly.
чтобы понять,
we need to talk to managers to understand what are the complaints of patients, because the complaints are usually received by managers, and this is indeed the field and the context that we can analyze and analyze our problem coming from this angle. I will show you a couple of suggestions that we ask, questions that we would ask on this topic. For example, doctors, if we were serving doctors, what would we ask? We could ask, what was the training that already given on the topic of the chronic pain syndrome? Next, what is your typical patient? It's an oncology-related patient or not? What is the age, young, elderly, etc. Next question, what are the challenges that you can face treating a patient with some oncology diagnosis? For example, it's we can just give different profiles of patients. Next question, what are the medicines that are available, and is there a shortage of any medicines? And last one here, we plan training. What can be the relevant topics for this training? So this is just the group of questions for doctors. And if you take a look at the scenario that I've shared with you earlier, you will see that indeed there are some blocks and topics, and you can follow those. For example, a patient profile, typical patient profile, and you can structure your questions under this block. Next, you can ask about challenges or doubts, or you can ask, can you remember an example? Examples work very well all the time. You can ask about some interesting examples. So those are the techniques of in-depth interview. Next group of people that we would be serving are the managers, leaders. First question here, what are the typical mistakes in therapy that you've come across? Next question, what do you think is important to train doctors in? And next one here, what are the restrictions and limitations regarding medicines? What do we need to take into account? Sometimes we've heard doctors saying, or managers saying, well, there is a good medicine, but we're just accustomed to using another one. And next, other group, to whom else would be useful to talk? It can be clinical pharmacologist, it can be quality assurance department that also checks against errors, mistakes, professionals. I don't know how it works in your countries and hospitals, but we have specialist professionals who check the medical records against mistakes. Also, a chief specialist. Here we have such a position. We can ask this person on what are the restrictions on medicines and what is expected in the future. For example, this person can know that there is a new dosage form being developed, and we will be training doctors in a couple of months, for example, and we should already include this new dosage form in our training, or maybe some dosage form is being abandoned, leaving. So we need to take this all into account, so we can just give a couple of questions like this. Sometimes you can ask a question like, what are you afraid of? And then the person will not answer. But if you ask, what are your doubts regarding this? You can get the answer. So you can also ask, give an example, and you can get no answer. But if you ask, what would you advise in this respect? So basically, the main idea is that you can reformulate your questions to get the answers that you are looking for. Right. Okay. So step 2. We plan training. Just a second. Some technical things. So we have identified our problem and what we should train people in. And we got a lot of information, specifics, what are the challenges, etc. How to save this information, how not to lose it. We suggest to plan training not proceeding from the topic. For example, our topic is diagnostics, therapy, base therapy, side effects, efficiency analysis. Those could be our topics. For example, symptoms therapy. But instead of this, we suggest to proceed from the expected training result, right? I guess you all know this model: knowledge, competences, skills that should be described in detail. When we draft a training program, there is a professional standard. For example, in Russia, we don't have a special federal standard on palliative care, but we still have the professional standard. But in this standard, the concepts and phrasing is quite general. But when we develop some specific programs, then usually we work with some specific audience, and we already understand quite a lot about this audience, and we should really take down to earth the results corresponding to the demand that is coming. I'll just give you an example. We were drafting a program on dyspnea, and our topic was oxygen therapy with severe or in-severe dyspnea and pharmacotherapy of severe dyspnea. Those were our topics. And so the expected training result for us was as follows. We wrote that the doctors should know the counterindications while prescribing oxygen therapy in patients with neuromuscular diseases. It's very important. It's for the first topic. And when it comes to pharmacotherapy, we focused more on using morphines, because morphines are used off-label while treating dyspnea. The decision of a team of doctors is needed here. And doctors were usually afraid of prescribing morphine in this respect because there are some side effects in the leaflet, and we just wrote it as a separate expected result of our training. And that was in 2021. Now we redrafted this course. I mean, we did it in 2024. So the topic is the same: pharmacotherapy of severe dyspnea. But here I just give you some main things, but something has already changed. For example, we saw that doctors are not afraid to prescribe morphine that much anymore, but the problem actually turned upside down. Quite often, doctors should focus on etiologic treatment of severe dyspnea, depending on mechanisms of its emergence and nosology. And another aspect here was starting doses, because different doctors offered and prescribed different doses at the beginning of all forms of short-acting morphine. And we wanted to work on this result. We wanted to unify it. So we were giving some exercises to achieve this particular result of unifying started doses. Another example, our favorite topic, pain relief and prescriptions. If we say prescribing narcotic drugs, well, what can we do here, right? Of course, we can just give video training and organize some workshops just to train people in legislation to enable them to learn this. How do we check it? Just test the knowledge. But just a second, sorry. For some reason, I find it difficult sometimes to click in between slides. So, our expected result. All doctors of the Center of Palliative Care know the rules how to issue prescriptions, including those that are reimbursed for opioid medicines, and they train their skills in prescribing medicines using some additional materials. We cannot, of course, expect that no doctor will make any mistake here. Well, of course, it's possible, but still, we wanted to provide some supportive materials for the doctors. First, the doctors would know that they could search for some information in those materials, and also we wanted doctors to train these skills, to drill it. And we couldn't do it offline. We decided to go with online, we also recorded some video workshops and how to test it, either in practice or using the digital simulator. And I'll show you what our digital simulator looked like. So basically, two things: supporting materials for searching for some information, and the testing simulator. And we would assess the success proceeding from the results of our test. So this is how this digital simulator looks like. There is a task to prescribe a medicine. And here in the right, you can see the recipe itself. And so here we actually recommend the doctor what guideline can be used here for some navigation. And then the doctor should fill in the fields and the form. And doctor has three trials here, and if he or she cannot do it after this, we can just once again instruct the doctor how to do it properly. So these guidelines are available both in the digital form and in hard copy, and well, this is only for Russia because it's based on the Russian legislation, and this one is also being changed quite often. And we also use Telegram. We've established a channel, this knowledge base on Telegram, so you can just go here and find the form of the recipe that you are searching for. So you can just search for it on Telegram and then get the hint on how to fill in this prescription form properly. What's also important to mention here regarding expected training results. When we train some soft skills, communication, quite often we do want to offer some communication training in the field of palliative care. When we want to also give some training in values. For example, in the Center of Palliative Care where I work, I guess actually everywhere, one of the main values of palliative care is that we do not treat a patient, we treat a person, a human being, because we really want to preserve the quality of life. And this is not only to fight with the physical symptoms, but there are many other things. Also, we want to change the attitude. Instead of working or doing something for patient, we work with the patient, where we need to make a decision on some supportive therapy or some nasogastric tube, etc. We always make this decision together with patients. So these are soft skills, and well, it's really difficult to measure those. And in this respect, we identify some vectors of our movement forward. And there is another aspect. When we talk about training in some non-material things, those that cannot really be measured, because when it comes to the treatment and pain diagnostics, this is more measurable. But when it comes to empathy, which is also important to develop, well, people are different, and here they come from different backgrounds and they have different characteristics. Somebody is more communicative, somebody is less, somebody is more empathic and somebody is less empathic. And we can train a little bit, but still, how to work here. And I guess And I think that we should think about what are the mindset characteristics that we want to influence.
We
worked on a training for communication. We have a new training course, and my colleague spoke about the nurse protocol, about the empathy. When you provoke an emotion that a patient is experiencing, you accept it, you support the patient, and this
из первых букв, забыла слово, складывается вот это nurse.
this is an abbreviation, nurse. An algorithm can be taught. An emotion can be named, then the algorithm of actions is described. But we should understand that before a person learns the algorithm, he or she should understand why it is important. Even if he or she can pronounce the words like, I can understand that what you are experiencing, or I can understand your pain, and so on. The diagnosis is like this, and you should do this, this, and this. Empathy is still very complicated as a system of emotions. It is more hard to train. We should think about it. And I have a small example for you. My computer is freezing. Sorry. So communication training envisages this, that a nurse or a physician should understand the difference between hearing and listening to a person. It is very important to make this difference. The importance of active listening shouldn't be underestimated. Listening is not the same as hearing.
Завершая тему шага 2 образовательные результаты,
if we speak about the results, we should see the cascade of results, actually. It is a cascade going from working problem to educational result. For example, the working result is the number of prescriptions for opioid medications that pharmacies do not accept has decreased to 5%. And we know that pharmacies do not take the medications because physicians cannot prescribe them in the right way. The general result of the training is that new doctors know how to write prescriptions for opioid medications without mistakes. And these are the detailed educational training results. Or new doctors, for example, know all the rules of prescriptions for opioid medications in accordance with Order 1094H. All physicians independently practice the skill of filling out all the 4 types of prescriptions using auxiliary materials. And here you can see the ABCD formula of Robert Meagher, which includes audience, behavior, conditions, and degree. So audience, for us, it means physicians working in the palliative care center for less than 6 months. Behavior, what does it mean? It means that they can diagnose pain, define its type and intensity. Condition, what does it mean? There are different types of patients. There are patients that are not verbal, speech impaired, comatose patients, patients with psychiatric disorders.
Чьим словам мы не можем до конца доверять.
If we have patients with dementia, for example, we can quite often trust their words. Degree, well, it means without mistake, without error. Well, it's actually what does it mean? A pain can be treated 50% in 50% of the cases. And now we are moving on to the second task. You can take either chronic pain syndrome or opioid analgesics or any topic that you are dealing with now. And could you please formulate one or two training results according to the ABCD formula? You can see it here now, and could you please share your wording, your proposals when it comes to the educational result in accordance with the ABCD formula.
Эсмин, может быть, вернуть кадр с примерами? Как будто бы так чуть-чуть
Ой,
лучше.
да-да-да,
Could you
да, прошу
please show
Всё,
the
спасибо.
examples?
Ага.
Yes, I think it's
Вот
better
тут я
like
еще видела
this.
на прошлое был задание вопрос, видимо, мало времени дала.
I have noticed
Вернусь.
the
Сейчас
question related
Да,
to the
Милана
first task.
Да,
Yes,
Милана
Milana
добавила вариант.
added another answer.
Пока коллеги, я надеюсь, пишут, понимаю, что это не то, как хочется проводить
I hope
субботний
that
день, писать в
you're
онлайне
working
образовательные результаты.
on the training
Очень бы уже не
results, on the
отвертеться
training
было в
outcomes.
онлайне,
I can understand that it's quite hard
лишить себя этого
to
удовольствия.
do this on a
Ир,
weekend
мы,
day.
по-моему, нормально, да, по времени идем, пока коллеги пишут?
Ира,
Да, в целом
Да.
мы в графике.
if it's okay when it comes to, I wanted to ask if
Коллеги, да, пожалуйста.
we are on time, if everything is fine. Yes,
Скажу,
it's
занудная,
okay.
трудная работа.
I
Для
can
нас, по крайней
understand
мере,
that
точно.
it's a
Но важно
nerdy job.
писать результаты.
It's quite hard and complicated to do, but well,
Дам пару минуточек.
it's something that we need. So a couple of minutes more.
Эсмин, опять кадр только с первым результатом на
Esmina,
аудиторию.
unfortunately, we can just see the first
Да, немножко
line
Ага,
related to
вот всё здорово.
audience.
Сейчас нормально,
Yes,
да, всё?
now it's fine. Thank you.
Да, и смотрите, мы результат формулируем не как вопрос.
And the training outcome should be formulated not as a question. Yes, I can see Milana's question. This is the question for conducting a study. And here we should reformulate it like physicians know the rules and so on. So we should formulate it as a result. For example, as a result of the training, it would be better if the physicians achieved this result. We should be honest with ourselves. It's very complicated to achieve all the results, but
Когда вот в гору поднимаешься, есть вот эти вот
when
точки,
you
которых надо
climb a
достичь.
mountain,
Алло,
you have some
врачи-онкологи занимаются
landmarks
абстракт-плохие
that you need to
новости по
achieve.
протоколу СПАЭК с онкологическим пациентам и членам их семей с
I can
применением
see
схемы
another
КЛАСС и обязательным
training result.
сбором обратной связи.
Oncologists
Да, отлично. То
can
есть мы уже
announce
понимаем,
bad
что
news in
кто
line with the SPIKES protocol to
врачи-онкологи что
cancer
делают,
patients
какие
and
протоколы
their families
опираются.
using the
Когда мы вот
nurse
так
scheme
сформулировали, нам потом
while
прописать
collecting the
план
feedback.
занятий,
Yes, it's very good.
программу
to formulate the training result like this, it's better for us to come up with a lesson plan or a training program afterwards. The devil is in detail. It is very correctly, precisely formulated task and result. Tamara, physicians and nurses working in the palliative care centers are aware of the development of pains related to bed sores and can diagnose the development and the intensity of the process, as well as the types and particularities related to the special dressing, and use them correctly and put them into a dossier. Yes, it's a very good training outcome, but I would devise it and present it as a number of results. Actually, you can elaborate on every point afterwards. It's just the general result. And I would provide an example related to bed sores dressings. We had a problem related to constant changes of dressing brands, and the staff cannot quite easily choose between the brands that change all the time, and there is a prompt. Actually, depending on the function of a dressing, a physician or a nurse can understand which dressing to use.
Я бы еще какой-то версии формулировки подождала, результаты одного бы разобрали, и можно было бы пойти.
Another training outcome, and then we could continue.
Например, вот пока, если кто-то еще пишет, тоже возьмем, да, Тамара знает особенности развития раневого процесса.
Tamara talked about the pains related to bed sores, and we could, for example, we could cite the groups of patients. Tamara says that surgeons address this problem as just a normal sore, and Tamara started to make the passport of the problem and got afraid of the scope of the issue. Yes, it's quite often like this. We understand the scope of the problem, and we think that the only solution of the problem is the training, but it's not always like this. Maybe it's the lack of algorithm, the lack of medication, or the medication that changes all the time. Education and training is something that is very important, but in the professional environment, it is just one of many tools that exist. And sometimes we have problems related to resources, to tools, and the deeper you dive into it, the more you understand the cause of the problem. Surgeons practice a more simplistic approach, and they quite often forget about the quality of life, about traumatism, and so on. Milana has come up with another example. Milana, I couldn't quite understand why there is C and D. Actually, it's one result that is detailed into A, B, C, D. So, for example, if our result is about the assessment of a pain in line with the scale.
Можно сказать, пожалуйста, Esmina, я извиняюсь.
Esmina, sorry, can I tell you what I meant? Actually, it was my first message. So A, it was about physicians. B, it was about the rules and actually I sent the message by mistake now. So actually ABCD, it's about one result. A, it was about the knowledge of how to prescribe prescribe a medication. So, for example, physicians know the rules on medication prescriptions. And maybe they know it by heart. This is maybe something that is important to you. So, A, physicians. B, physicians know the rules of medication prescriptions. Then C, the physicians know the precise. See, they know the precise legislation related to prescription. Actually, the result is something that is more general, and then you you detail it into ABCD. So you have one result. For example, physicians know the rules of medication prescription in line with the decree. Know it by heart. They know what decrees are used, and they address to them in their daily work. So if we are talking about the result related to the assessment of pain, but they do not use the visual scale that is important to you. So for you, the result would be as like this. Who physicians? What do? They use the visual scales to assess the pain. They use it in all the cases when it comes to mentally nonverbal patients who do not have mental illnesses. Then if you're talking about putting down the names in Latin in a correct way, for example, they know by heart the name of a medication, but they cannot put it down in the right way. So you do the same. Who? All physicians, or for example, several physicians of this or that organization. So what do? They can put down prescriptions in Latin by in a hard copy or online for all types of prescriptions. This is your result. So actually you have cited several results here, and it would be very clear for you. So if you want them to know the medications, so you do or legislation related to medication, you would create a training on this very topic and make the ABCD formula on this. You put it very right, saying that physicians can prescribe. So the verb here is very important because we're talking about a skill that should be trained. This is something that should be honed. So physicians practice the skill of putting down prescriptions in Latin. And then, depending on this, you come up with a training. How are you going to make the training? You make a simulator, or you are providing an online training. So it depends on this.
они сумеют правильно выписывать рецепты,
I understood what you meant. So you want, for example, doctors to prescribe the recipes properly in 90% of cases. So it's quite a realistic goal, right? So not that everybody would prescribe everything 100% properly, but 90% of doctors will prescribe recipes properly in line with the laws and statutory instruments, and they will make mistakes and not more than 10%. So this is one of the results, and you describe it in detail in line with each and every aspect. For example, here you can write they know. In another case, you write they have learned to write it properly. I hope that I managed to explain it, but if I haven't, then please say so and I'll try to give you some more details. Milana, is it more clear for you or you got even more confused?
Я поняла, Esmina, спасибо
I got
большое.
it,
Действительно,
Esmina.
хороший
Thanks a lot.
инструмент.
Indeed, it's a good
Я
instrument.
еще потренируюсь, если
I
честно,
will keep
после
training,
Zoom.
honestly, after our workshop in Zoom. Right, you need to test it, right? So you need to take one aspect and work on it. In just real life, you would say topics, right? Prescription in line with the legislation, pain assessment. But here you take each and every small topic that you'd like to work on, and you formulate this result for each topic based on this formula. Let us move on, and I'll show you one of the examples. So here you can also scan this QR code and see the example in detail. So we've built the matrix of educational results of a program on the introduction, treatment of patients with stomas, tubes, and catheters. There we also formulated our expected training results. So, to sum up these two steps. First, research and formulating expected training results. Why is it important? It is important because they enable us to avoid some just overview lectures that is about everything but also about nothing, right? Sometimes we join some training event and we discuss something and that was quite interesting, but after it you don't take anything home. Second, it allows us to not overwhelm the audience with unnecessary information. For example, if your audience is the international one, there are people that you don't know, then it's going to be more general. But if you know your audience very well, you can be very specific. Why should we also formulate the expected results? For example, I need to understand, do I want doctors to know the whole legislation in full and in every detail, or do I want to focus on something very specific? Or maybe the protocol of delivering bad news, right? There are different tools and spikes, nerves, etc. But it's important for me to understand what I really want to communicate. It's important, very important, not to just take content from a large container and try to put it in a bottleneck. The bottle with a small neck, right? In this case, if you do it, then your content, water, will mostly just go beyond your bottle with the small neck. You need to proceed from this. That's how you can assess the time that will be necessary for this, and you can deliver the information that will be sufficient and not too much. Otherwise, if you just put this water from the container to a small bottle, you can just show your expertise, but you will not be able to make this training efficient. And also another thing, the more specific our results has been formulated, the easier it will be for us to train and also plan the format of training, offline or online, individual, group training. What are the exercises that we need to do, what equipment to use. We'll also talk about mannequins a bit later. So the better you planned, the easier this will be for you to do this. Just in general, if you plan your vacation and you say, I like to go to the seaside, this is very general, right? But if you say and plan some specific trip to some specific seaside resort, then you can plan your way by plane, by car, or somehow else. So we also need to plan, and this is the third block of our discussion today, we need to plan the format of our training. I hope that you can see my screen. Here we say at the top of this triangle, we say, what do we train in? To the left, how do we assess it? And to the right, how do we train exactly? It's about formats of training. If we say that our expected result is doctors don't only know how to prescribe medicines, or if we say they know how to prescribe medicines, then we can just give a lecture and then test their knowledge. This will be enough for this goal. But if we say they have a good command of prescribing medicines, or they have trained their skill, then we should first train them. And then we need to give some practical tool to train, to drill, and then we will assess the result not through the test alone, but we will see whether the doctors can fill in the recipes properly. Or if our result, the doctors know nurse protocol, we can assess it as just asking, tell me about the nurse protocol, right? This will be enough. But if our training goal is our doctors have trained in nurse protocol, then we can assess the success through some role play situations, some simulated situations, or we can even monitor and see the doctors acting in real life. So let's talk about formats in more details. As I said, format is a wide concept. There can be different formats, offline, online, hybrid. Here I gave a couple of examples. We can have simultaneous training when, for example, we have a real-time discussion, right? It's not recorded. It can be a webinar, it can be lecture, it can be workshop, case review and analysis, role play, Q&A, discussion, and some exercises to drill some manual skills. If it's a simultaneous training, that means that I gave you material at some point of time and you got it at some other point of time. It can be the video lesson, it can be long read, it can be online simulation, it can be VR simulation, etc. For example, the program on diagnostics and therapy of chronic pain syndrome in palliative care. The expected educational results. Doctors and our groups of stakeholders can diagnose the type and intensity, severity of pain syndrome in different groups of patients. Next one, they can properly prescribe the therapy of chronic pain syndrome of different genesis in line with the pain relief ladder by the WHO, taking into account individual specificities of a patient. Then they can also recalculate the dosages of narcotic drugs, making use of the table of recalculating equipotential dosages. And next one here, they can explain to a patient in simple language what is the situation, and they can answer some difficult questions and debunk some biases and myths. So here you can see that these are our expected training results. And we used different formats. So there is no direct correlation between the left one here on the slide where we have training results and the right one, which are the formats of training. So what could be done here? Lectures, video lessons. Next, we also analyzed clinical tasks, cases. For example, this is our patient, these are individual specifics of this patient, this is the physical condition, let's prescribe therapy. And this should be done in a live mode, right? So the trainees should answer the questions and the lecturer will comment on this. Next one here, protocols and some memos. Next one here, exercises and tasks on some online platform. So the trainees should choose the therapy scheme and calculate dosages. It's very specific. Next one here, scripts of answers to some typical questions coming from a patient. So we do understand that if a doctor asks a question, if I go to a pharmacy and I want to get the narcotic drug or narcotic medicine with a prescription, will I get arrested, for example, etc. So these are very typical questions, and we can use scripts here with the main ideas. We can also just give some video examples of the correct, proper communication in this respect. These are examples of exercises that we used on our online platform. Here we describe the patient, the situation, and below we give multiple answers to choose among. This is for therapy. So this is not to test clinical mindset, but just to test the knowledge of some dosages. For example, here comes another task, proceeding from the table of recalculating equipotential dosages. Which medicine will you choose? Exercise number 3, to prioritize these medicines in line with their analgesic effect. So on online platform, we can work with exercises where our trainees do not really need to share their thinking, their train of thought, right? Because if we would like to understand how a trainee thinks, then, well, somebody needs to listen to this train of thought and then give some feedback. But exercises are for more specific questions and answers. Another example, this is about soft skills. So the expected result, a nurse understands why it's important to comment on her or his actions to a patient while moving or feeding the patient. So here our expectation is that the nurse understands. We've seen and observed in our environment that quite often nurses do not really notify the patient, now I'm going to do this, now I'm going to do that. Nurses do not comment on this beforehand, and we would like to tackle this problem. We speak about it at different conferences, and our head nurse understands this importance, but we need to train in this, right? So what shall we train a nurse in? Just to voice and notify about all the actions? Well, this is quite simple, right? But it's very important to make the nurse understand why it is important, right? Sometimes a nurse can think that it's not very important to do this, and we need to change this mindset. And how can we do this? What are the formats? We can actually perform different trainings when the nurse is lying on the bed, or we can also just use a VR simulator,
ситуацию
virtual reality.
да,
So we put
чтобы
a nurse in a
сама эта сестра у
patient's
нас
shoes.
продумала
So a
какой-то
nurse should really
бесстыдный,
understand
беспомощный,
what it feels
напряженный,
like to be
когда ты
scared,
лежишь,
to
с тобой
be
что-то делают, а
blind,
ты не можешь даже вот
not to
или
be able
возразить,
to
что, или как
monitor the
бы дать понять,
situation
что тебе
when a
страшно.
patient
Или
is
над тобой
scared but
стоят и
cannot even
обсуждают,
express his or her feelings.
как там
Or what does it feel
вчера
like
отметили день рождения
when,
у мужа, да,
for
перестилая
example, the
постельное
nurses just
белье.
discuss some
Понять это можно только
personal and
попробовав на
private
себе,
topics
и поэтому вот мы и
while
предлагаем сесть за
performing some
тренинги,
actions
ну,
on
как
the
костюм
patient.
тяжелого человека, ты
So
наряжаешься, идешь к медсестре
we
на
use
посту,
the
и что-то
costume
ее
or
там
simulator
спрашиваешь, когда
of an
пациент
elderly
уйдет. А
person,
она бумажку
right, to
заполняет,
put
поднос себе что-то
the
отвечает,
nurse in a
не думая,
position
что
of
человек
the
плохо
patient,
слышит, плохо видит и вообще еле дошел. Или, ой, прошу
just to
прощения,
understand what it feels
Formulating,
like.
да, кладем
For
одну ногу на
example,
сестру,
when we
завязываем глаза, она пациент, другой берем
train
кормить. И так,
feeding,
чтобы ее вот
we
гайка
just
омлет.
put a nurse
И когда
on
ты
a
не
bed
знаешь, что тебе
in
дают,
a
ну, глаза для
position
усиления
of a
эффекта,
patient, and we don't
начинаешь
tell the nurse
докураться и
what
как бы говорить, какая гадость,
she
и
or
чтобы
he
ты
is
понимаешь, что
gonna
я
be
ем.
fed with.
Вот тогда, возможно, это где-то
This is
откроется
just to
посмотреть
let the
важно.
nurse
Потому
know what
что
it feels
сложного
like and
ничего в
why
этом
it
нет.
is important
Навыки нет.
to comment
Говорить,
on what's going to
озвучивать.
be done with the patient and what the
И
patient going to get
VR-тренажер,
as food,
не знаю, видели
etc.
вы это или нет,
Or
хотела
VR
показать.
simulator.
Видимо, не понимаю, что
I'm not
происходит.
sure if you've already seen it or not.
Сейчас, секунду. Так, что-то пошло не так.
Just a second.
VR-тренажер мне очень
It's
эта
a
идея нравится.
VR simulator,
Попробую.
and I really like
Вот,
this video. I hope I can
play
play it now.
называется. Не понимаю, почему не проигрывается.
Sorry, I'm having some troubles with
Посмотрите,
playing
кому
this
интересно. В
video.
общем, тут
Okay, so
тренажер,
those who are interested, you
очки
can also see it
виртуальной
later.
реальности.
So here, the
И
VR glasses are
момент,
used,
да, проигрывалось,
or
что
goggles.
случилось. Тут показывают, как пациент с деменцией,
We
видимо, ему
show
кажется, что вокруг
a patient
какие-то
with
мухи летают.
dementia, and
И
this
помогающий
patient
человек
thinks that
приходит,
there are
и
flies
вместо того, чтобы сказать,
around this patient.
какие
And
мухи, что ты
when a
вообще
caregiver
несешь,
comes,
он там говорит, давай вместе половим
the
этих мух.
caregiver
Хорошее видео.
says, well, I don't
А,
see any flies. What are you talking about? And
Что еще
then
важно,
the
помимо
VR can
результатов
be used here just
образовательных,
to let the
чтобы выбрать
caregiver
формат?
know
Помимо того, что ты
how it
понимаешь,
feels like.
куда ты идешь, ну, конечно, надо оценить
Getting back to the
ресурсы,
formats of the training,
надо
of course,
оценить
we need to assess the
ограничения на
resources
старте.
and
Например,
restrictions
у
at the
наших
very beginning.
учащихся есть время 2 дня, там, 3 дня
For
очно
example,
учиться,
if
а у
our
разработчиков, а у
students
преподавателей.
have 2 or 3 days for
Если,
training,
например, цифровые ресурсы мы
do they
хотим
have this
задействовать,
time
у них вообще
actually
есть
or
доступ
not?
к персональным
Do
компьютерам
the
или
designers of the
смартфонам?
training programs have
Регламенты,
time for this?
протоколы есть по
What
тому,
are
чему
the
мы учим?
facilities? What are
Количество
the
участников
protocols
обучения. Вот
available
сейчас
on the
тоже покажу
topic that
пример.
we are trying to train people in?
А,
I'll just give you another
Мы
example.
уже близки к финальному заданию.
We are coming
Тема
to
большая, в 1,5 часа уложиться сложно, но в 2
our
уложимся,
final
по мнению меня.
exercise.
Вот, например, мы делали сейчас тренинг не так
So,
давно
just
по
recently, we've
контролю качества
organized a
медицинской
workshop on
деятельности
the
в работе
quality
с нашими
control of
медсестрами.
medical
Мы
practices
написали
in the
для
work
себя
of a head
результат, что
nurse.
наши медсестры
So, our
знают,
expected result was our nurses know
в кавычках, да, должны кавычки случайно здесь, знают точки контроля качества
quality
ухода за
control
пациентами с
points
различными тягостными
when
симптомами,
they take
состояниями
care of
и умеют
patients
это
with
применять на
different
практике. То есть, что мы
symptoms
хотим,
and
чтобы старшая
severe
медсестра
conditions. And
знает, по каким точкам
they
контроля оценить,
can
насколько
apply these control points in
пациентам с
practice.
болью помогли, с запором,
So
с
the head nurse
симптомами, с
should
контрактурами. Вот
have
она
good
взяла
command over
отделение
control points to
просто или
control whether all
с
patients
обходом,
in her
знает, на что
department
смотреть,
were
как она будет
treated
оценивать,
properly.
история
And
болезни, что
this
ее
head nurse should
коллектив
assess
работает правильно.
the quality of
И
work
какие
of
могли бы быть
the
форматы?
nurses that report to
Мы
her.
могли бы сказать, ну вот
What could be
есть
the possible
простые контроль
formats of this
качества, да, и
training?
проведение
We can
даже
draft the
простое.
checklists of quality
Давайте им
control.
дадим кейсы,
We can
и
also
пусть они
give
как-то там эти
cases to
кейсы оценят.
nurses,
Ну вот,
and they
например,
can
у нас
use
везде стоят
the
камеры
cases
видеонаблюдения,
proceeding from these
периодически
checklists.
случаются
For
падения,
example, we
тренер
have
это записывает. Вот
cameras
мы
also, video
можем поставить
cameras in the
видеокейс,
department,
пациент
and
падает,
when something happens, then we can analyze this case of what has happened, why this has happened, etc. Was the position of the bed proper or not? Was the nurse nearby or not, etc. Just an example. Or we could say, well, you know, the best format is supervisions. Some of the supervisors are just following the nurse at the department and can give feedback. We also tested it quite some time ago as a format, but expert was just working with their own checklist.
Чек-листы по СОПам, по конкретным манипуляциям.
So we have the reglementation, and there are no checklists for the senior nurse, and we do not have enough time to prepare them for the training course. And so we came up with the following solution. So we would give lectures on how to care for patients with severe pain. And then we should make sure that all the nurses understand what it means to provide high quality treatment and care. Then nurses were divided into groups, and every group should study the symptoms, and the nurses should understand what care should be provided to the patients having this or that symptom. So what is the thing that should be taken into account in this case? Is it clinical records or something else? The most important thing is how the nurse reacts, actually. How can she or he understand that the care was given in the right way? And finally, the results were presented, checklists were shared. And then drafts of checklists were provided. They were accumulated, and as a result, we had a brainstorming format of the training course. So this was about different formats. By and large, I wanted you to see this sequence. So we have a working problem, we have an objective of the training, we understand quite deeply what should be trained, then results are formulated, and knowing the results, formats are chosen. And we will take into account the results that we have formulated, and we'll try to think about the method of training. So, for example, a physician or a nurse can put the urinary catheter strictly according to the algorithm and demonstrates the 90% mastery of the algorithm and the certification. We have had a certification with several halls with the experts looking at nurses or physicians who were performing different manipulations. What was checked? The algorithm and manipulations that are performed in the correct way. So how the employees should be trained to achieve this result. So if you have any ideas, please raise a hand, turn on your mic, or put it in the chat.
Можно голосом, можно в чат написать.
Yes, please turn on your mic if you want, or you can put it down in the chat.
Обучение на манекене, видеозапись процедуры как образец. Да, это нам поможет. Алло, вот точно это надо использовать.
Yes, using a dummy or making a video record of the procedure and taking it as an example. Yes, it's very important to look at the manipulation. It's a very good tool. This is the tool that we are using as well. And I would add that if a nurse should show it during the certification process, she or he should be able to perform it in a practical manner from the beginning to the end. Actually, he or she should come into the room, say hello to the dummy, then perform the manipulations show. So it means that a nurse should know what to do from the beginning to the end according to the algorithm. Yes, and peer review, peer checking should be performed as well. Yes. There's a question as well. When is the right moment to assess the results of the training? I will give the answer a little bit later. Look, there is another version of this result. For example, all doctors and nurses of the organization, in our case, it's more than 800 people, know how to perform urinary catheter insertion strictly according to the algorithm and demonstrate 90% mastery of the algorithm on certification. And in our case, for example, we do not have enough experts, or we do not have enough dummies, or we have time limits. Peer assessment should be applied, or cascade training, or peer review is conducted, and notes are taken by students themselves. So the situation changes. The results should be put down. It is very important because the wording can vary depending on who is making notes, actually. If you are applying cascade training, you as the chief officer say to yourself, well, physicians are trained, but how can I be sure that nurses who are under this physician are trained as well? So you can see that everything should be detailed. And there is another example of results. It's a very good one as well. So if we want that a student, a doctor or nurse, should understand the risks of late replacement of the nasogastric tube and is able to recognize complications arising from late replacement. Yes, and Milana said that if we work with dummies, it looks more realistic, actually. So we will go back to the task. Well, it's important because our nurses or physicians who do rounds at home, and they should pay attention to the replacement of the nasogastric tube on time. And for them to understand it better, they should know what happens if the nasogastric tube is replaced quite late. So they should recognize complications. So, for example, how this skill should be trained. So we cannot use a dummy in this case, for example.
Ввести стандарты, да, как часто, да, мы должны
Standards
менять.
should be introduced. They should be changed
Абсолютно верно, это должны быть
regularly
стандарты.
as well. Yes, you're
Нам еще
absolutely
важно, что
right.
они не
You should
просто их
introduce
знали, они
standards,
поняли
and it's
риск.
important for
То
the
есть это пришло
nurses
тоже
and
важно.
physicians
Стандарты, да,
to
должны быть
understand the
ввести
risks.
стандарты. Мы говорим,
But
они
standards are
понимают
important,
риск
yes.
и умеют
But
распознать
we have said
риск.
that the most important thing is to understand the risks and recognize the complications that can ensue.
Стандарты нам будут говорить, и тоже мы даем, как часто нужно менять, какие
According to
там
standards, we would be able to
признаки
see
осложнений, да, когда при каком осложнении надо срочно или планово менять.
what complication can
Это всё должно
provoke
быть. Что еще можно
the
сделать?
replacement of the tube, for example. What else should be done?
Ну, подскажу, в этой матрице образовательных результатов, по-моему, там даже есть уже
The
решение по 100
metrics of the
кейсы
training
надо показывать. То есть
outcomes
надо, например, показывать видеопрезентации с визуализацией
reads it
возможных
as well, I
проблем,
think.
как пишет Тамара, при несвоевременной замене. Да, абсолютно.
Tamara
Во-первых, надо
says that
продемонстрировать,
a
что
video
может быть.
presentation
Прям
of the problem that are visualized
видеопрезентация, продемонстрировать эти
should be
осложнения.
ensured.
Можно кейсы
Yes,
дать.
that's right.
Можно
Or
дать
you
кейсы,
can
в которых
perform a
уже
case
будут
study, for
описаны или
example,
показаны с
and the case
фотографией, с
would show the
видеоосложнения,
photos or the videos
и
of
спросить,
complications.
из-за чего они произошли.
And
Подвести
a question
их
can be put
понимание того,
down
что
why
из-за несвоевременной
this
замены.
complication
Можно вообще
took
просто
place. Why did this
накидать
complication take place?
сплошных
And
карточек с
you
фотографией
can also
с
show
осложнениями.
quite
Ну, если, допустим, недавно
horrible
пришли молодые врачи, которые
photographs.
понимают,
This could be very
и
useful for
ужаснуть всех тем,
the
какие
doctors, for
могут быть
physicians
осложнения,
that
если
have arrived
несвоевременно
recently.
заменили стому или зонд.
This applies as well
Разработка изучения
to
с опытом
stomas and
разработки
probes.
работы с НГЗ в подразделении. Да, это стандарты, конечно, они должны быть. Как часто
Standards
меняться, и их
should be
должны
developed and
Милана, дай
studied
тестовые задания с несколькими
in
выборами
every
ответов, чтобы
department. Yes, Tamara, right.
плановое правильное
And Milana
осложнение.
said
Дать,
tests
чтобы
should be
правильное
given.
осложнение. Да, можно использовать,
Multiple
это называется
choice tests
формирующее
should be
оценивание, когда
given.
мы просто, по сути, уже даем
Yes,
задание
you
на
are
оценку
right
знаний,
as
но
well.
цель у нас не
We should assess
аттестовать
the
людей, а
knowledge,
понять
but the goal
способ обучения.
is not to provide
Ну, потом, если они,
certification,
допустим,
but just
выбирают
to
неправильно, с ними
get the
обсудить.
understanding of the
Коллеги, ну
knowledge that
да,
the
спасибо. То есть
staff
я
has.
просто хотела вам
Colleagues,
продемонстрировать, хотелось бы
thank you.
больше позаниматься. Поняла, конечно, что формат
It would be
отдельная
great if we
тема,
had
должна была быть.
more time for
Покажу
this.
сама просто один пример, и
I
расскажу.
would just
На
give
этом
you one
закончу.
example, and
Медицинская
this
сестра,
will
вот
be
у нас
it.
был результат, умеет составлять план
Another
ухода,
result, for example, the nurse
учитывая индивидуальные потребности, особенности пациента.
is able to develop a care plan,
И
taking into
какое
account the
нам
individual needs and
предложили, нам
characteristics
было
of
важно, чтобы
a
медсестра,
patient. So what was important for us?
кстати, тут еще был вариант ответа, часто обсуждает
Sorry,
проблемы в малых группах.
another
Да, она же согласна. Я
message
бы,
to
то
discuss
есть это либо
regularly the
обсуждение
problems in small
проблемы, как
groups.
обсуждение
Yes, I
кейсов, как
agree with
учебный
you.
формат, либо то, что вы
The
предлагаете,
format of
может быть как
cases
один
can
из
be applied,
рабочих форматов, да, то, о
or
чем мы говорили,
what you
чтобы не
suggest
было так, на обучении
doing
пришли кейсы
could
разобрали,
be
а в
one of
работе этой теме внимания
discussion
не уделяется. Как
formats.
учебные форматы, как
This
рабочие,
could be a
там.
training format
Ну и
and
вот
a working
последний
format
пример,
as well.
вернусь к нему. Как сделать так, чтобы
So,
у нас
and
вот если
then
это
the
про
last
ценности,
example,
у
we
нас
talked
есть
about
эта ценность относиться,
values.
видеть не пациента, а человека,
We should
и план
see
ухода,
a person
конечно,
and not a
делать,
patient,
учитывая,
and our
думая
care
про то, что перед
plan
тобой человек. И мы давали
should
такие
take this
упражнения,
into account. And we have given
медсестры давали
a
кейсы, говорили
task.
голые факты о пациенте, медицинские. Возраст,
Nurses
нозология, какие-то
learned
симптомы,
some simple
молодой
facts,
пациент,
basic facts about a
логический
patient,
диагноз,
his age, his diagnosis,
понимает,
female or male,
есть
the
тошнота,
medication
как
that
сделать
he or
там
she
план
takes,
ухода. А
and the
потом
nurse
они
should
делали
come up
этот план
with
ухода, мы
a
им
care
давали
plan.
дополнительные, скажем так, человеческие факты.
And then
Вот
we
он,
gave to this
ну, несколько примеров,
nurse
там было больше.
some personal facts
Например,
about this
он
person, about this patient.
мусульманин,
For example, he or
рядом
she
с
is a
ним
Muslim,
его невеста,
his bride is next to him. Before that, he used to be an athlete, the man of the family, and now he turned into a person who is very weak. He can hardly walk on his own, and so on. So we provided personal details, and if a nurse is able to think about him as a person, she would rule out some of types of care. For example, he could not use a diaper. He preferred to go to the toilet on his own. Or if he's a Muslim, a nurse who is a female should not provide all types of care. So a nurse cannot do it on her own. So this should be taken into account. Well, the fourth task, I don't have the time to speak about it. And in conclusion, I would just say that we should understand what working problem we're solving through training and ensure that the training is the right tool for solving the problem. We should conduct preliminary research to understand exactly what to train, what the opportunities and limitations are. We should formulate the training outcomes and learning vectors. We should be always guided by the working problem. We should plan training and assessment so that they would match the intended training outcomes. And once the training has been planned, we should go back to step one and assess whether the training solves the problem at hand. When it comes to assessment, well, we can assess block by block. A block of information is provided, then we assess it. It can be applied if you have a big training course. If it's a short training course, the results can be assessed just after the training course is given. When it comes to practical application, well, we should take some time because the theory course is followed by a practical course, and some time should pass before we will be able to assess the results, because the practical part actually depends on many factors, because it depends on the chief medical officer if he or she really needs it. Then the control, if the right performance of all the algorithm is controlled or not. Obviously, the objective of a professional training is the good practical result. And I think if we talk about your question about assessment, I think it should be given in more detail. The answer should be more detailed, and you have my contacts, my phone number, so you can arrange a meeting with me if you need it in WhatsApp or Telegram. I have a Telegram channel on training. Everything that I have spoken about is in the Telegram channel as well. And you can find something that would be interesting to you there. Thank you very much. So it's 1 p.m. now.
Еще есть завершающее слово, поэтому я чуть вышла, но тема большая и сложная. Спасибо
This
всем,
is a
кто
vast,
до
quite
конца
complicated
слушал.
topic. Thank you very much for everyone who
Да, я
stayed
на
with
самом
us
деле
till the
хочу
end.
отдать должное
Yes,
прекрасной
I
нашей аудитории,
would
которая
like to
последняя
thank
задавала вопросы,
our
которая
guests
посвятила часть своего выходного дня,
who
я
stayed with us
предполагаю,
till
больше
the end
часа
on the
нашему
weekend,
вебинару. И
who posed questions,
я
got answers.
убеждена,
Now I'm
но
convinced
что это было точно не бесполезно.
that the workshop
Хочу
was
еще раз
useful.
поблагодарить Эсмину, нашего
I would
прекрасного
like
спикера,
to
потому что
thank
действительно материал
Esmina,
огромный.
a wonderful speaker, because indeed
Даже 2
this
часа это
topic
очень мало
is
для
very
такой
vast,
темы,
and 2
но
hours
Эсмине
is not
удалось
enough. But I think Esmina
как-то четко и
managed
последовательно
to
уложить ее в повествование, которое,
touch upon it in a
по-моему, каждый слайд
precise
можно
manner.
прямо вот брать
And I
и
think every
записывать
slide
в
could be
работу.
taken and
Я
applied in
хочу
practice.
обязательно обратить внимание
I would
всех
like to
наших
pay
слушателей
the attention of
и
all our
попросить
guests
вас в
and
будущем
colleagues
поделиться с вашими коллегами или, может
to
быть,
the fact that it
единомышленниками,
would be
с кем
great
вы
if you could
планируете
share
организовывать обучение, теми материалами,
the
которые
materials that we
обязательно
had provided,
ФПС
that
выпустит
the
позднее.
PACE
Чуть-чуть мы постараемся
Foundation
сделать это
will
быстрее.
provide after that as well.
Туда обязательно будут входить видеозаписи
So it will
2
include the
воркшопов, которые
video
проводила
recordings of the
Эсмина,
2 workshops that
презентации,
Esmina
которые
has
вы
had,
видели на этих
the
занятиях.
presentations
И
as well.
обязательно мы сформируем конспекты для тех,
And
кому, может быть, не
we
очень
will
удобно
make notes
смотреть видео, но при этом
for
есть
those
возможность почитать
who do not
в
like to
дороге
watch
или
videos,
где вам будет удобнее. Это наш такой стандартный
who
пакет
prefer
документов.
just to
Когда мы
read
его
the notes.
сделаем, мы
So
обязательно
this is our
опубликуем
typical
новость в
package
наших
of
соцсетях.
documents,
Сейчас в
package of
чате еще
files
раз
that we
появится
provide,
ссылка на
and
все наши
we
контакты.
will
Призываю вас
leave a link to
подписываться
all our
и
contacts.
делиться со
I'm
своими
asking you,
коллегами
I'm
этими
urging you
материалами
to
и
share
подписываться
these
на
materials
отсылку
with your
нашу
colleagues.
почтовую. Это можно сделать на сайте
We
поиски.
have
И
a
также еще раз
regular
хочу напомнить о том, что
news
сейчас, мне
digest.
кажется, это прекрасная
So
возможность.
please
У фонда
do not
поиски
forget about this.
открыт прием
And I
заявок
would like
в
to remind
грантовой
you
программе.
that
И, на мой
PACE
взгляд, это
is providing
один из очень
grants.
доступных вариантов гранта.
It is one of
Причем
the types of grants that is quite
заявка там
easily
заполняется в
affordable.
свободной форме, в
You can
письменной, поэтому
apply
очень призываю вас не игнорировать такую
whenever
возможность.
you
Наша
like.
программа,
It's
срок
quite
приема
a
заявки
loose version of
заканчивается через
application.
неделю, поэтому
And
очень хотелось бы
please pay
увидеть
attention that
больше
the application
заявок от
process
специалистов, от
will be
нашей
closed in a
аудитории,
week.
и
So
мы бы хотели
this is
очень
the
вас
deadline.
поддержать.
And
Также на
we would
сайте есть
like
вся
you
информация о том,
to apply.
куда отправить заявку, как ее
You will be
оформить.
able to find all
Все
the
это
necessary
есть на сайте
information on
поиски.
our website, how to
Да, и вот,
apply,
собственно, вы сейчас
when,
видите QR-код.
via
Все
what type
материалы,
of
которые
media.
нам передаст Эсмина, мы
Here
обязательно
is the
также
QR
разошлем
code
всем участникам, которые регистрировались сегодня
as
на
a
это
link to our
занятие.
website.
И
And all the
хочу
materials that
поблагодарить
Esmina has provided will be
Эсмину,
sent to you
вас,
as well.
слушателей, наших
Esmina,
прекрасных
guests,
переводчиков Анну Ахматову и
interpreters,
Юлию Кулешову, которые
Anna
с нами
Akmaeva
сегодня 2
and Yulia
часа
Kvashova, thank you
провели.
as well
Спасибо вам
very
огромное.
much. You stayed with us
И прекрасную
for
команду
these 2
ПЭСИ,
hours.
которая
And I
сделала
thank
возможным
the
проведение
PACE
сегодняшней
team as
встречи.
well, who that
Желаю всем прекрасных выходных,
made
хорошо
our
отдохнуть
meeting possible.
и с новыми
Have a good
силами и с новыми
weekend,
знаниями
and
войти в новую неделю
a new
и
week
начать их
will be
применять.
started with
Всего вам
this
доброго,
new
дорогие
knowledge, new
коллеги.
competences that you
Спасибо,
have
коллеги.
just
До
got.
встречи.
Colleagues,
До
thank you
свидания.
very much. Goodbye. Have a good weekend.